So, hello everybody. Now formally on on the recording. My name is Lea Turunen, and I'm from the Somatic Experiencing Finland ry and the Somatic Perspectives Oy, which is the Somatic Experiencing Training Organizer in Finland. And today we are happy to have Ariel Giarretto with us to talk about what is somatic experiencing. So, Ariel, what about if you just introduce yourself? I think you do it, but you will do it better than I would do.
I like the way you pronounce my name. Thank you. It sounds very exotic the way you do it.
How do you do it?
Oh, it's perfect. I like it. You just have a little bit of a flair to it. So thank you for that. Anyway, greetings all of you, and I'm happy to see that there are a number of you that are interested in this work because it's quite phenomenal work, and I love talking about it. My background is I went the traditional psychological route. I have a master's degree in counseling psychology with an emphasis on marriage and family therapy. And after I got out of graduate school, I was really discouraged. I felt like I had no foundation for really what healing is and how to help people. So I went on my own personal journey and started to study all different kinds of therapies. And what I was very aware of is how the body was missed. And as someone that was actually very interested in a medical orientation, I actually really wanted to be a doctor more than anything, but couldn't get past chemistry. um, and so when I was introduced to somatic experiencing, I was really excited because it added the physiological, it added an understanding of the body, and it also included the body in treatment. So it was this huge revelation for me. And I remember I was like this little kid jumping up and down, like, yes, this is what I have been waiting for, that has felt like the missing piece in all the therapeutic trainings that I had been doing. So I met Peter Levine in 1999 and immediately jumped into learning the training. I took the training about 10 days after I met him. I trained to be faculty. I became faculty about 6 years after I took the training. And now I teach this work all over the world. Been doing it since 2005 is when I first became faculty. And in addition to somatic experiencing, I was very interested in the body. And during graduate school, I became trained as a doula, which is a childbirth assistant. So for about 8 years, I attended over 50 births, which was really, really wonderful because it's so body oriented. And I realized that the training that I got as a doula, which was to support families in moving through the fear of childbirth, as well as helping particularly women in this situation learn to trust their bodies. And so through my early 20s, I learned how to sit, in this medical situation and this incredibly natural and normal situation, and support women in having babies. And it was an incredible experience. I also did, after graduate school, a lot of somatically body-oriented trainings, including a lot of touch work. I became a massage therapist in addition to being a psychotherapist. I did a training as a sex educator, which is my focus right now. That's mostly what I do. I work with sexual violence and war, rape, and sexual assault. And then I got a lot of additional training in pre and perinatal and trauma, early attachment, complex trauma, developmental trauma. And so I integrate all of that understanding and awareness into the SE training. In fact, a lot of us do. And so SE is an unusual model, and what really appealed to me after studying all this psychology is that it presented, like I said, this missing area of awareness. As a psychologist, I was trained to listen. I was trained to analyze. I was trained to come up with deep insights and to support people in connecting to emotions. And what SE added, not only to my professional life, but even greater to my personal life, was an awareness of this body that we carry around. And what is so extraordinarily wonderful about SE as a treatment model, particularly when it comes to post-traumatic stress, complex trauma, is it recognizes that we also have a physiology, in addition to our narrative, and that our body is constantly responding. And SE focuses on how the body responds under threat. Yeah. Most of you know all about that because the fight, flight, and freeze response is pretty much common knowledge. But what Peter did, the way that SE was developed, so I'm kind of going through the list of questions now, Lee. Is that okay? You're supposed to
Yeah,
ask.
I'm like, this is more than just who is Ariel, but yes.
You can ask me a question about what is SE, right? I'm sort of doing that already, but go ahead. We'll follow your.
No, that's fine. Yeah.
So go ahead.
Just go with the flow.
I can talk for days about this, which of course I do. Yeah. So.
Hmm. Well, yeah, it was wonderful to hear your rich background. So well, which well illustrates that somatic experiencing is a complementary training, right? So you know everybody who has a basic training in could be psychology, psychotherapy, massage therapy, well, plenty of things, basically helping professions. Yeah, it would be then kind of adding on to onto that work, right?
Yeah, exactly. And Peter Levine, who developed it in the 60s, really recognized that that the model of SE, the orientation of SE, is something that can be applied to all different kinds of professions, and it is designed for that. It can be a standalone treatment. Many of us that are trained in it only do SE, but most people apply the principles of the model to their existing profession. So if you're a doctor, you would doctor in an SE with an SE understanding. If you are a nurse or a physiotherapist, you would take the information and the understanding of the body and you would apply the SE principles to your work. If you're a social worker, a psychologist, you would also add the understanding of the physiology to add a beautiful supplement to what you already learned. If you're a touch therapist, like Lea said, you will start to approach the body and the work that you do in more of a trauma-informed and SE way. And SE invites all different types of professions into the training, which is a very unusual thing. Most of us, you know, those of us that are psychologically trained, we're used to being with other psychologists. Those of us that are body work trained, we're used to being with that or with our people. But SE realizes that there's this incredibly rich blending of learning and orientations that create this fantastic environment. And there's a lot of discussion about how you do what you do and start to apply the principles of SE in a way that can enrich and deepen your practice. And as someone who's been teaching, you know, for almost 20 years now, it'll be 20 years next year, this is what I hear over and over again, is how much this work enhances people's professions. The secret is how much it enhances your personal life. You know, a lot of people apply the knowledge to their children and their parenting styles, to being with their partners. They apply it to their own self. SE can be used in a way like a moment-to-moment mindfulness practice to help someone get through challenging times. It's also beautifully designed for post-traumatic stress, early developmental and complex trauma. And it's also a fantastic tool to prepare for something, whether you're preparing for a medical procedure, or you're preparing for a test, or you're preparing to speak publicly. So the basic principles are extraordinarily adaptable, and it's just such a life learning experience, and that's why so many people love it and keep doing it, because it's good on so many levels.
Mhm. You know, you've mentioned post-traumatic stress, and like when we talk about SE, we do talk about trauma. Could you tell us how SE understands trauma? Because it is actually more than the PTSD, which is sometimes sort of in the psychotherapy world seen as that's the trauma, but SE has a bit broader view, right?
Yeah, well, first of all, we spend a fair amount of time in the very early modules getting an understanding of how the body, how the physiology responds to stress, right? To anything that is perceived as overwhelming, right? It doesn't even have to be a traditional trauma. It could be getting ready for childbirth. It could be, like I said, getting ready for a big exam or something. So we understand that when the body starts to feel affected by something that feels overwhelming, that if we work with the physiology, and what I mean by that is we go into the effect, into the response. We don't just talk about it, we directly experience it. And that's why it's called somatic experiencing, right? Somebody comes in and they want to talk about, what do people talk about in therapy? Their mothers, right? Or they talk about their, absent father. So what SE adds is an awareness that when we are talking about something, that our whole body is responding. Our heart rate might increase. We might, lose saliva in the mouth. Our breathing changes. There are often, in reaction to these thoughts or these discussions, some other contractions that start to happen. And so SE really helps us add this layer of awareness of whatever it is that someone is talking about, that we also want to take it into this deeper level. Yeah. So it's not about, tell me about your mother. It's, as you talk about your mother, what starts to happen inside? Yeah. How are you responding? And the autonomic nervous system, which is always there, it is designed, first of all, to help us recover and respond to threat. Again, whether it's talking about a frightening moment with our mothers, but it is designed for us to respond. There's an action. Yeah, that's what the nervous system does. It is there to help us survive challenging moments. And it also helps us know where to move towards safety. Yeah, there is action. And I know when I was trained psychologically, this piece of understanding the nervous system and the action patterns that accompany the nervous system, was completely avoided. There wasn't actually even an awareness of that when I went through my psychological training. So SE adds this layer of understanding that when there's anything that feels overwhelming, I mean, it could be seeing a turtle. It doesn't really matter what it is. We want to have a deeper understanding of what the body is doing, and we want to support it in perhaps some kind of action. The action could be moving away, protecting oneself. The action could be moving towards someone for protection and safety. And it's these action patterns, we call them incomplete responses, that are often locked in people's bodies when they have experienced something overwhelming, particularly as a child when resources are limited. So the SE therapist can come in and watch the body, recognize how it's responding just to talking about the mother, and try to really get into the core of what response needs to happen. Yeah. Is there, again, protection? Is there something that wants to be spoken? Is there an action of moving away? So this is a very simplistic description of what we add when we are talking about trauma. Yeah, we're talking about anything that is personally overwhelming. And obviously, trauma is one of those things. Yeah.
Maybe just sort of additional question to this, because of course, trauma does have sort of psychological effects or can have, but can you say a little bit about how SE sort of understands the other kinds of effect that trauma can have? So I think a difference to maybe some other modalities is that in the training there's talk about sort of physical symptoms that so the link between the body, mind, and then the physical ailments that people might have.
Yeah, I mean, that is another thing that's really, really interesting, is starting to see the connection between the physiological reactions to unfinished or unprocessed, what we call activation in the body, and how it can lead to chronic conditions, right? I mean, a very very simple explanation would be, if I'm really feeling overwhelmed and stressed, there is, what's very common about that is tension, right? Many of us hold neck tension, jaw tension, shoulder, spine tension. Yeah. And when we're in that kind of chronic state, it can start to lead to a lot of other more long-term issues like chronic pain patterns, right? Sometimes it leads to profound digestive disorders. It can lead to autoimmune disorders. So the physiology and the emotions are very, very much connected. And SE is just great with that, because we're working with chronic situations through the nervous system, right? Somebody that is highly, highly reactive, we help them learn to calm down from the inside, right? And the calming down from the inside starts to allow some of that bracing and those chronic reactions to start to soften and settle. And so SE's fantastic with things like chronic pain. And there's a whole section in the SE training about working with autoimmune, working with syndromes, working with migraines. Yeah. So we do address the physical in addition to the emotional. So it's a very, very rich learning experience taking the training. Did I answer your question?
I think you did. I mean, if for people listening, you have sort of spin-off questions or something's not clear, please do put in the chat. One of the questions that we received in advance was about, like, as a client or patient, who could benefit from SE and what kind of symptoms SE is effective. But basically, listening to you, I would already maybe summarize that it's really a wide spectrum of symptoms and types of clients. I don't know if you want to elaborate further on that, but you've already mentioned a lot of examples.
Well, I think again, SE, like I said, can be used in a number of ways, right? If you have someone that's in a crisis situation, maybe they're in a domestic violence situation, yeah, it can really help people just survive some very, very intense experiences. It gives them techniques. You know, they're not going to solve their current crisis, but we can help them survive it a little bit more, and hopefully with less impact on the body for the long term. So it can be used very much in the present. It's also very good if any of you are working in crisis. For example, when the Ukrainian war broke out, we had literally dozens, if not hundreds, of SE therapists step up and offer stabilization and support to refugees, and also to the therapists that were working with refugees. So it can be a short-term stabilization model. It's fabulous for early childhood trauma. It's fabulous for big event trauma, you know, like falls or sexual assault, physical assault, accidents. So it can work for single incident. There's not a lot of people that have single incident trauma. It's usually more long-term. It's very good for preparing people for surgical procedures and recovering from surgical procedures. Now, the way that I use it is because I work almost entirely with sexuality, with sexual dysfunction, sexual violence, and sexual assault and abuse. Mostly what I'm doing is I'm repairing people's relationships to their body. Yeah, I'm focused on helping the body become a place of ease. I'm helping people move shame out of the way so that they can learn to embrace and celebrate pleasure. So anybody who has had a lot of harm done to their body, SE is just fantastic for that. And I just want to say, and on the other side of it, what is it not good at? I'm sure there's going to be some questions about that. And what it's not good at are things that are chemically bigger than what we can do as a clinician. For example, it's not going to cure schizophrenia. It's not going to cure bipolar. It might relax and regulate a bipolar person, but it's not going to totally fix that. It's not going to necessarily fix really extreme obsessive compulsive disorder. So things that tend to be so extreme that are chemically bigger than what we can do, SC is not great at. But what it is good at is it's very, very good at working with people that have an interest in healing, yeah, that have an interest in working in a different way than they've ever worked before, especially those that have done a lot of talk therapy. Sometimes there needs to be a fair amount of work just in helping people develop a relationship with their body, because we tend not to feel our bodies. Yeah, they're like, it's the lost horizon there. So sometimes we can't really get to the trauma, if you will, until we start to build more confidence in going inside. And some people are just a lot more resistant to that. I did some consultation today with someone who was working with someone that came in a year ago and felt nothing, absolutely nothing. And she celebrated today. So it took a year. where the client was able for the first time to recognize that some part of them began to settle and relax. So for some people, it requires some patience. Some people take to it right away. Yeah, you can make an incredible difference just in one session with some people. Yeah. And some, we have to build enough trust and relationship in order for someone to feel safe enough going inside. So there are our spectrums. And sometimes, like when I was working, people would come in for a single incident, and that was lovely. Yeah, could work for 6 or 10 sessions on a car accident, and they go on their way and they work out the other stuff with their psychologist. Yeah, so there can be short-term therapy solutions with the model, and there can be really beautiful long-term sort of orientation where the person makes profound shift on the inside. And that's exciting to watch.
Indeed. I'm lost in my questions as their discussion flows. I think we've sort of covered a lot of ground. Maybe we sort of go into, we might come back to some of the questions if we feel like it, but how does an SE session usually look like? Because I mean, some people, when you talk about body, they think of a massage, and you know, like what's their sort of positioning? How long are they? Can it be done on Zoom? Kind of how does this sort of SE work happen in practice, and what can one expect?
Well, that's a huge question, and I mean, my experience of training professionals is, you know, like I said, each practitioner will do it their own way. And sometimes right away in the first session, you can start to work with helping people become aware of these dramatic shifts that are happening in their bodies. So some people will take to it right away. Other people, if they're not there for a body-oriented or somatic practice, it might take some time to, in a way, talk them into it, to believe that actually feeling the self is important. So a lot of times when the word is out, and this is again from doing this for 20 years, I see that as soon as the word is out that people are trained in a somatically oriented trauma treatment, that trauma starts to pour in. Yeah. And people want to try something different. So they will flock to those that are somatically trained because they're interested in it, or they've heard about it, or they heard Peter Levine talk or something. The interest in somatic work right now is it's huge. I don't know how it is in Finland because it hasn't been introduced there so much, but in so many countries, we can't keep up with the demand. So my point being is that when people come in really wanting to do the somatic work, you've got the cooperation and the interest and the motivation, and you know, you can move right in because the transference is already, you have something I want and I'm excited to learn it. What else was I supposed to say?
I don't know, maybe I would add, and you can agree or disagree that sort of in the training, most of the work happens seated, like, you know,
Oh, yeah.
as in any sort of, well, or most psychotherapy sessions, so sort of face to face or in a little bit of an angle. But then, of course, like if somebody is a massage therapist in their practice, they might actually work with the clients sort of on a massage table. There is one part of the training that happens that way. So it's sort of then how one applies it depends on one's one's profession, actually. And there was a question on does the method work remotely? I think these days a lot of people that I know do SE sessions remotely. Of course, face to face, at least in my kind of experience and opinion, is sometimes more effective, especially in those cases, kind of difficulties of connecting with the body. But yeah, as far as I know people, since COVID, a lot of people are working remotely. What's your experience about that, Ariel?
Yeah, well, certainly COVID proved that it can be extremely effective. And in fact, many of our touch practitioners, physiotherapists, occupational therapists, and massage therapists were also working remotely. So it definitely can be done. And so in a perfect situation, doing it together is obviously, from a relational perspective, the most powerful. And SE is a profoundly relational model, which is extremely important. SE can be done remotely. It can be done in groups, done a lot of group work. It can be done with couples. It can be done with kids, so it's really extraordinarily adaptable. And even the touch therapists have been in awe of what they can accomplish without actually having to put hands on people. And so what that looks like is sometimes people will do self-touch. Yeah. I like to work standing up. Yeah. Because I tend to do a lot of really embodiment and empowerment kind of exercises. So I work sitting down, but I like to work standing up and moving around. So, then you have yoga people, you have yoga instructors, that will do yoga and integrate SE into it. So SE can be effective when you're doing a downward facing dog, so it's, it's very applicable.
Hmm.
Do we want to address some of the questions in the chat? What do you think, Leah? Should we do?
Yeah, we could. I've seen it popping up, so before it piles up too high, Amita, do you want to send some over here?
I'm just going to open the chat.
Okay, yeah, you can also do that.
So our international humanitarian organizations using SE, yeah. It's more like that SE volunteers themselves in humanitarian organizations. So for example, during a lot of the big disasters, whether it was the earthquakes in China, earthquakes in Japan, earthquakes in Turkey, yeah, during the Ukrainian war, SE definitely was integrated, welcomed, and used a huge amount in these situations. Sometimes there are people within the SE organization that have connections to these humanitarian organizations, and so with a connection like that, when some of the disasters were happening in the US, often where we connected was things like Catholic Charities. Yeah, so we come in, we offer, we have to be welcomed. We're not going to force it on anyone, but a lot of what we do is we train the professionals, right? When we went to Japan, we trained Japanese professionals. We didn't work directly. We really feel strongly that we want to support the care providers. So that's a lot of what we do. What is the relationship of TRE to SE? Well, SE has been around, a very, very long time. And the principles of TRE, it feels to me we're kind of ripped off from SE. And I know a number of people that are trained in both. Some people are in SE and then they take TRE. Some people take TRE and then do SE. And each of them have their own value. Yeah. And so just like anything else, it's knowing, and it's like EMDR as well. Yeah. It's like knowing when to apply what for the most, effective response. So, I think that SE is obviously much, much, much more complex and will work with a lot more different kinds of traumas. It's not intended to be any kind of a quick fix, yeah, like TRE is intended to do. Is SC evidence-based? Absolutely. We have quite a number of research studies that are on the Somatic Experiencing website. You can look at the US one. I don't know if it's in the European one because most of the studies have been done in the US. We've got a couple of long-term studies that happened in Israel, and there's another follow-up one. We have a very beautiful collection of Turkish SEPs that are connected to a number of universities. And every time there is some kind of a humanitarian response, they are doing research and compiling its effectiveness as a short-term model. Those, I'm not sure if they are available in English, but I know that our Turkish research team got an award recently, and it was very exciting. So yeah. And is it a growing evidence? Probably.
Yeah, I mean, I know that the Somatic Experiencing International kind of, I think in the early days, that organization, the head organization, I don't know, maybe wasn't super organized for research, but certainly for the last years, there has been kind of a more focus on it. I think there's a research committee and there's this SE Research Award since a couple of years. And there's been at least one research seminar, I think a year ago. So in a way, there is an effort ongoing to try and to consolidate and reinforce the evidence base. Because SE, there's a lot of what I hear, and there's a lot of clinicians using it and really convinced that it works. But then of course, whether there has been this randomized control studies and or randomized control trial studies, etc. That's there are some of those, but there could be more.
Yeah, I think Israel has done the most extensive in that. One of the challenging things that has gotten in the way of us doing more research is that there isn't a protocol for SE. SE is very much adapted to who you're working with, and you're going to work with each person in their own particular capacity. So you can't just lay a protocol on someone. In short-term crisis response, you can, and that's why there's been so much research that's been done more as a crisis stabilization model. But when it really comes to working specifically with clients, we all do SE differently. I'm sure I do it very differently than Lea does it. And that's mostly because we really want to, like I say, we don't want to impose anything on anyone. We are invitational. Yeah. We are there following the client in their own pace. And as soon as you start to get techniquey, a lot of our traumatized clients pick up on it. Yeah. And they don't like it. Yeah. They want us to really be more relational. And that is one of the primary focuses on SE is how to establish a very, very deep sense of safety in the relational field. Yeah. So,
yeah, there was, I think one of the questions was related to that. And there was also something I received together with registrations, kind of what practices or what exercises there is in the SE. And I mean, I would say there are some, but that's kind of not the essence of SE. It's not like we have the exercise 1, 2, 3, 4, 5, and then that's what we do. It's really kind of foundational skills that then, you would, like you say, depending on the client, somebody needs more, perhaps a bit activated, a bit boosting of their sympathetic nervous system, as we would say, and somebody might need more settling. And so, yeah, like we learn something in the training, but it's not like we have a sort of exercise book that we use.
No, no, we don't. I mean, I think there's some basic exercises, which is what I mentioned earlier, which is when someone is talking, if they've got a narrative. And what we do is we start to get, we want the client to be curious about what's happening inside of them as they talk, right? So someone comes in and they're talking about their mother, and I'm going to say, oh, wow, okay. So as you're talking about your mother, what are you noticing inside? Yeah. So I would say that if we were going to make a list of exercises, it would be more a list of questions, a list of invitational questions that encourage someone to be curious about what's happening. Yeah. So for example, I'm thinking about my mother. And as I talk about my mother, I notice that my mouth gets dry and my chest starts to constrict and I lose my legs. Yeah. So the SE therapist wants to be curious about that. And so through sensation or maybe through imagery, we would say, so how would it be just to spend a little time with that tightness in your chest? Yeah. Say more about that. Right. So if there was any kind of a protocol, we want to know, what is happening as they talk about something. We want to know where it's happening. We want to get a sense of it, a flavor of it. Yeah. Is it getting small? Is it expanding too quickly? Is it cutting off the ability to speak? Is it sending other parts of the body into freeze? Yeah. And so, we start to get really fascinated with just how complex and how many dozens of reactions a body is experiencing by just talking about their mother, And so when we're moving inside to this direct contact with the body, it's giving us a lot of information. And see, this is what's different than the Jacobson muscle relaxation or anything like that, or even EMDR, is that we're going into these experiences. And as we go into them, like I said earlier, there is almost always an action. And that's often what is missing in other therapies. Yeah. So the reaction that I have, the action is when I think about my mother, I want to get small. I want to disappear. I want to hide. When I connect with my mother, I might get angry and I might want to say, back off, give me some space. Yeah. So all of these physiological experiences also connect to something emotional. And often the emotional connects to some kind of a physical action. And this is what makes SE unique. So we are exploring how the body wants to respond in the present in relationship to talking about something. And that action is either something that did happen when I hear my mother speak. I got small as a child and I hid. Or it's something the body wanted to do, but it didn't get to do. And this is what I find absolutely amazing about SE, is that a lot of times we're focused on what didn't happen. Sometimes what's traumatizing is not what happened, it's what didn't happen. It's the escape that I wasn't able to do. Yeah. I mean, obviously it's traumatizing, to feel trapped. Yeah. But what I want to work on with someone is what didn't get to happen. And if I can support the body, we call this completing an incomplete response. My mother image comes in, I get small. My SE practitioner says, all right, so as you get small, and if anything was possible, what would your body like to do? I want to run out of there. Yeah, there's the action that didn't get to happen. And I am supported in doing now what I didn't get to do back then. And this is what helps trauma resolve. Yeah. Often what's missing is support. So if my body could do anything, what I would really like to do is run to my grandmother. My grandmother lived in another country. I couldn't do that. Yeah. So we can also bring in these beautiful, imaginary, if you will, but very, very deeply connected to what would have made that situation more livable. Yeah. Less terrifying. And this is what is unique to SE, is that we're not just working with what happened. We're working what wanted to happen. We are working with missing action patterns. We are working with missing support that wanted to happen in these moments of, great terror. And we're also helping people identify the amazing resilience inside of what they did do in order to survive some of these overwhelming events. So you see, it's a much bigger, complex picture than just working, say, even just with the nervous system. We're really moving into these completions. And that's what makes post-traumatic stress go away. Yeah. And I get excited talking about it because it is so amazingly effective. And of all the work that I've done and all the trainings I've taken, there has never been anything other than SE that brings in these missing experiences. And to me, that's what heals trauma. Now, intergenerational trauma, Ani Sophia is asking you about intergenerational trauma. And, absolutely, we do a whole piece on intergenerational trauma in the trainings. And, it's certainly recognizing the influence of the ancestors, right? We all know, epigenetically, how trauma is passed through. Yeah. So, absolutely, we can use it as an understanding of where we came from just by sitting with the experience of my grandmother that, I don't know, made it through a plague and was starving. Yeah. So we can start to really get a sense. We look at intergenerational trauma in a couple of ways. One is, what were the challenges that our ancestors had? Yeah. That formed them, that shaped their nervous systems. How was that passed on to the next generation? How familiar are their challenges, right? Are there challenges that our ancestors have that are familiar to what I'm dealing with now? Yeah. And is there some kind of resilience that my ancestors had that has also been passed down to me? Yeah. So, again, we are embodying these things. Yeah. We're not just talking about them, but we're getting a real felt sense experience of what our ancestors had to go through and how that formed them and continued to affect the next generation. Can SE be used with children? Absolutely. There is a lot of people that work with SE. We have a couple of fantastic books. One is called Trauma Proofing Your Child. The other one is called Through a Child's Eyes, It Won't Hurt Forever. Big, thick book. So there's a lot of applications working with children and also preventing trauma with children. If they're going to have a medical procedure, or how to help them adjust to getting a dental procedure. Yeah. So it's a fantastic tool working with kids. There is a study going on. Yeah, there's a study in Sweden. That's right. Yeah. The case of PTSD, what would be a medium duration of therapy? It completely depends on the person. Yeah. There's nothing that we can do that's magical that's going to, I don't know, force someone. We have to wait and be invitational. And what I found was true in my practice is that some people will come in for a while and they'll learn to identify what is going on in their bodies. They'll learn to regulate themselves so that they can survive their week. And then they'll go away for a while. Yeah. And then they'll come back, maybe 6 months or a year later, they'll do another layer of work on something. Something comes up in their childhood and they want to do a bit of a tune-up. Yeah. And I've also had people that when I was working, I worked with them for 5 or 6 years. So, again, you can make a lot of progress when someone comes in for a specific thing like sleeplessness or having, problems with nightmares or flashbacks. You can work with those and be, quite effective fairly quickly with that. But other things are longer term. And a lot of what we're doing, obviously, in our therapeutic relationships is just, helping people heal from the relationship trauma they have. Yeah. So that's a very big piece of it. Yes, SE can definitely be done in groups. I do it all the time. Let's see, are the seminars standalone? If I was to start with you, but couldn't do some of them due to timing.
So I think that's related to the training. So what's the time? Maybe we talk still a little bit generally about SE, and then we can kind of zoom in a little bit to the training in maybe sort of 10 minutes. There was a question from one of the people who registered about secondary traumatization, kind of how can one protect oneself, and perhaps behind that question, does SE have something kind of special in that regard?
Yeah. Yeah, absolutely. And I mean, part of the training is to have an enormous awareness of yourself, right? You can't take anybody anywhere. We believe you can't take anybody anywhere where you haven't been. And so when we are working with people, we are constantly connecting very briefly with ourselves and making sure that if we are being impacted by somebody's challenging story, that we are taking a second or two to just, be connected to ourselves. Sometimes, the way I teach is that when I'm sitting and hearing a very, very big piece of a story, I will take care of both of us by saying, wow, this is really big. Why don't we both just take a moment right now and just notice how this is impacting both of us. So I train my therapists to also be really, really kind to themselves, and we don't have to push through anything. We don't have to push through intense stories. In fact, it's really good modeling when we find ourselves getting impacted that we take a pause, we tune inside. Again, it's not long. It doesn't take away from the timing with the client, but just to maybe just one breath, being able just to notice the impact of these stories. And then I also teach how important it is in between sessions to do a little bit of a body scan and notice, wow, is anything really affecting me that I might have to spend more time? And that happens. Yeah. I'm a really big believer in peer support. That's what I did when I was doing a lot of my own trauma, not research, but I was doing my sessions as a therapist. I met every week with another SE therapist, and we just debriefed about some of the really, really intense clients that we had. And that's really important, to make sure that you have that. I wanted to just talk, Aussie, is it, that has a question about Zhenlin And the difference between, I mean, definitely, and Peter Levine gives a lot of credit to Eugene Gendland about the felt sense and focusing techniques. And I've had a lot of focusing myself while I was learning SE. And what's similar, and actually it's a wonderful foundation for having a language. Gendland is beautiful about helping people get curious about what's inside. Where SE takes off is again this action that I was talking about, right? That we tune into the felt sense, we tune into the body, and then we broaden our awareness to what's happening in the rest of the body. And we recognize that a lot of times when there is a somatic experience, something wants to happen from that. Yeah. So that would be something that we add on is the sensory motor awareness, the patterns of wanting to take an action. Sometimes the action is having a voice about something. Yeah. So that's how it's different. But we definitely use some of his language that he uses. It's actually quite fabulous. Any difference between US trainings and European? No, not at all. The only difference is that in Europe, most of the time they're 6-day, and in the US, most of the time they are 4 days, 3 times a year. So if you were to start in Europe and you would go to the US, the problem is that if you're started with a 6-day, it's going to mess up because you're going to end up in a 4-day. And you're either going to miss something or you're going to have something that the American doesn't have. So,
But if you do like a whole year, let's say beginner year in one place and then you shift, that's totally possible.
yeah. And it is possible, again, just to very quickly answer the question above, it is possible to go to different countries if the scheduling doesn't work out. But it's really important also that you do everything you can to stay with the same cohort. And the reason that is that you build some really deep and beautiful relationships, and you will be practicing with people from your cohort outside of the training and getting together with them. But from a pure curriculum standpoint, all of the teachers pretty much follow the same curriculum. We just do it all very differently.
Yeah, so it's also for an organizer, I mean, it's same curriculum, but of course each teacher has their style and background. So for the organizer, it's also a matter of choosing who to invite. I think we have a fabulous team already, and the third year teacher is yet to be confirmed. So Ariel would be in the Finnish training teaching the second year, but yeah, you are teaching all over Europe and also in the US. So the teachers do cross over the Atlantic.
Yeah, we are all over the world.
Yeah. One difference, so if people are looking across countries, so the teaching is the same, then there are some minor differences. So in Europe, there is the European Association of Somatic Experiencing that does sort of regulate the European actors. And for example, in Europe, we require the 2-day introduction workshop, which is not the case in US. I think there is a 3-hour introduction sort of webinar. So that's one difference. And then also the personal sessions and their supervisions, exactly how many, that depends on each country. More or less it's the same, but in some countries they've decided to request more. So those are kind of some of the nitty-gritty
And
differences.
the other differences is that a lot of the trainings are done in their local language with a translator. Yeah. So like when I teach in Turkey, or I'm teaching in Georgia, or where else do I teach? Germany, Switzerland, there is Italy, there's always a translator. Yeah. And so that is sometimes the good news and the bad news. The good news is that it can slow things down a little bit. The bad news is that there's less students that you can practice with if you don't speak whatever native language is that. So there's sometimes a bit of a disadvantage if you go to a country that speaks a language that you don't speak, in terms of just being able to practice with people.
Mm.
I know when I'm translated, I can't teach as much. Yeah, because it takes twice as long. So
Mm. There was one of the questions related to training. I think we're sort of sliding that way, is that during the SE training, when can we start integrating what we learn into our own work? And how much of our own nervous system regulation should we have done prior to working with clients?
well, if I ruled the universe, I would have everybody take a session or two before joining the training, and not work on trauma, just work on one's relationships to being in groups, to learning new things. Because if you are able to do a certain amount of your own regulation, you will survive a trauma training much better, you know. It's incredibly activating for most people, even though we do it in this really beautifully slow way. But it's like we're dealing with trauma, and so it can be overwhelming for people. So having a session or two just on working with things that you find create anxiety or activation, and learning to recognize that in yourself, and discovering a few ways of regulating it can really help you get more out of the training, because more of you will be present for it. But it's not essential. I mean, all the teachers spend a fair amount of time, helping you learn what your regulation, focusing on regulation. Yeah. So you'll learn that as you go. In terms of when you apply it, you can apply it if you have a client. If you start the training on Monday and you have a client on Monday night, you can apply it. There's no like, nothing is going to stop you from experimenting. Yeah. So I think the skills that we learn in the SE training are immediately applicable. Yeah. And they do build on each other, right? So we can talk a little bit about the training. The first year, we actually don't talk about trauma. We talk about the body, and we learn all of the basic principles of the SE model. So you're learning so many techniques and so many exercises and so much interesting information that a lot of people get excited about going back to their practices and applying it immediately. Now, some people are shy or insecure, and they don't apply it until they do it a few more modules. So it's really up to you. We have no opinion about that. We want you to start to practice. We want you to start applying, because SE is a lot like learning a language or an instrument. It is awkward at first. If I hand you a violin, you're going to sound terrible for a long time. But the only way you're going to get better is if you keep plugging along. Yeah. And that means that you keep experimenting in your own practices with what works and what doesn't work. Let me just say one thing: you are probably not going to hurt anybody. It's really hard to hurt people with this model. You might open something up, happen, but that's fantastic. That's actually information. Yeah, that's like, oh, good, there's something to work on. Um, but it's such a gentle and such a slow model, that again, you'll be so much better at it if you start trying and practicing right away. I recommend doing that.
Okay. There was a question about how is somatic therapy regulated or supervised in Finland or in Europe? or worldwide. I can just say that sort of somatic experiencing, how should I say, since it's an additional training, you know, if you are a psychotherapist, at least in Finland, your work would be regulated as the work of this Finnish Valvira recognized psychotherapist. If you are a physiotherapist, you know, you would kind of follow the regulation of your profession, and then SE is just sort of additional tool set or set of skills that you would be applying in that job. So to my knowledge, at least in Finland, there is no specific sort of regulation. Then, of course, at the level of SE, there is the head organization in the US and the European Association that do have, for example, ethical guidelines and standards, and we would be talking about those in the training. And there's an ethical committee, for example, at the European level. So, you know, if there are issues coming up with practitioners, you know, there are ways to handle those. So that's kind of all I would say about that. I don't know if you want to add anything, Ariel.
Oh, no, I think you said it very well. Yeah.
Yeah. And so regarding the trainings, there was a question on, you know, are they in person, online? So the new training that would be starting in Finland in April, we've planned it to be totally in person in Helsinki. During COVID, there was a shift due to the circumstances to online. Last summer, the European Association did decide that we can still offer part of the training online if we so wish, but it's limited to 12 days because there is value in face-to-face. But in Finland, we did make the decision that we would want to offer the full face-to-face experience. On the organizer side, we've done our training fully in person, so we do see value in that. In some other countries, there are trainings that are sort of partially online.
Don't recommend doing it online unless you absolutely have to. It can happen, and it actually worked surprisingly well during COVID, but I can't you know, emphasize how important it is to do this live and in person. And just make, besides, it's a lot more fun.
Yeah. Yeah, it's a lot of their SE practitioner skills is to read the other one's body. And it's a little bit easier when you actually can see the whole body. On screen, we tend to sort of see the face and the shoulders, and it takes a bit more practice to pick on the cues with that limited view.
Yeah.
Are you zooming in on some other questions? So Amita, have there been
We've handled most of them.
important ones that we've missed?
I think everything has been answered so far.
Okay. Let me just maybe show 2 slides, or I will maybe stop the recording here. Then I will show 2 slides more specifically about the context in Finland, things that are coming up. And then if we still have time, I think we will, there will be still a few minutes for spontaneous questions, and nobody needs to be stressed about the recording. So let me just, I won't end the meeting, I will end the recording.